So for those that don't know, my name's Joel and I'm from Cliniko, and I've got Pete here with me who's from Medipass that do online healthcare payments. And we were excited by the news yesterday that the government's announced that allied health practitioners can get rebates through Medicare for telehealth. So that's what we want to talk about primarily today. My thoughts are we'll do some general information about how that all works. I've already received some specific questions from people about it as well that I'll go through, and I know there's a lot more questions coming through the Q&A in here. We'll cover those. I want to talk about how you can achieve this claiming with technology, and then if we still have time and people are interested, I can do a demo in Cliniko on how you do telehealth and also Medicare claiming remotely. But probably to start with, welcome Pete, and maybe you can also give us a quick summary of the announcement from yesterday.
Yeah, thanks for having me, Joel. So the announcement, it actually was from Monday, but there were previous restrictions on what providers and what patients can use telehealth for the most common Medicare funding scheme, which is chronic disease management. That's now been lifted. And so effectively, any chronic disease management provider, along with a eligible patient, can use telehealth to deliver those services. So I've never seen Medicare move so fast on this, but it's now available and you can actually deliver the services and have them backdated from the 13th of March. These are valid until the 20th of September, but possibly could go longer.
So with the backdating, if people weren't planning to do the bulk billing for it already, how does that work?
Yeah, so on the backdating, there's a few conditions which we'll go through on bulk billing, but if you've previously delivered a telehealth consultation for a patient, and let's say it's for chronic disease management, you can now lodge a bulk bill claim for that patient. Now, if you charge that patient out of pocket, you'll need to make sure that they've been rebated for that, because the bulk bill payment comes from Medicare to the provider directly.
Okay, so even if you charge them a different amount in the session because you didn't know you were getting bulk billing at that point, you can refund that back to them and then do this, retrospective bulk billing.
Yeah, correct. You'll still need to go through and meet the other eligibility requirements and ensure that you have patient consent to lodge a bulk bill,
Sure.
Give them the statement of benefit, but otherwise, absolutely, yeah.
All right, so if I can jump into some quick questions, some of the more common ones that I've been hearing from people. One thing I want to cover before I do that is I did read the announcement also, and there was one bit in there that I found a little conflicting, which I just thought I would touch on. And that is that they said you can use almost any system to do your telehealth for this. So you can use Skype, you can use like Google Hangouts, you can use Zoom, a whole bunch of systems they said are okay to use. But it came with a small caveat afterwards that said you also need to make sure you meet the Australian privacy rules with doing so. And most of those systems do not. So I would just suggest to the people listening now, if you're using Cliniko Telehealth, we do meet all of the Australian privacy principles. It's no problem. And there's plenty of other systems out there that do as well, but particularly those that are designed for telehealth. So even though that announcement stated these are all the systems you can use, I would just be careful because it also stated you need to meet the Australian privacy principles. I don't know if they're going to provide further clarification. I know in the US, for example, they've scrambled a bit and they've actually said you can use a system that doesn't meet the HIPAA requirements over there, which is the US's sort of patient information requirements. And to let people get up and running fast, they've said the systems don't need to meet it right away. And maybe that's what our government was leaning towards too, I don't know. But so far what they said indicated that it still does need to meet like our Australian privacy principles. So I would just be conscious with whatever tool you use, make sure it's like built for purpose for healthcare. So with that bit said, I think the number one thing people are asking about is what professions are included now. So the big change here was it's not just psychology and counselling and other ones that were already enabled, as I'm aware, and now there's a lot more professions. And what professions are there? And I know specifically we've been asked about acupuncture and traditional Chinese medicine.
Yeah, so there's a number of different schemes under Medicare where a patient and a provider can do eligible services. In the case of these new COVID telehealth codes, if you're previously delivering chronic disease management sessions for Medicare and you're one of those eligible allied healthcare providers, you can continue doing it today using telehealth methods. There's a number of different, yep.
So that's anyone that was able to do bulk billing before in allied health can do now?
Essentially, yeah. And that includes everything from Aboriginal Torres Strait Islander, chiropractors, psychologists, dietetics, exercise physiology, osteopath, physiotherapy, podiatry, psychology, social worker, speech therapy.
Okay. Is that the entire list that you just read out? Is that all of them?
No, I haven't gone through all of them. There's additional occupational therapists, nurse practitioners, midwife, optometrist, audiologist.
So do you know specifically, do you know if naturopath, I'm seeing the questions coming, do you know if naturopath is in the list?
Yeah, naturopath is not currently in the list for chronic disease management sessions.
Okay.
Now that's either telehealth or in person. Same goes for acupuncture and Chinese medicine.
Okay.
Not currently in the list.
Okay. And counseling?
Counseling is, there's some specific requirements around counseling, and there's different programs that counseling falls under. More counseling services are delivered with those who have a registration as a social worker and mental health for eating disorders or for focused psychological strategies.
Okay. And just a reminder for people, if you do have questions, if you can put them in the Q&A section, that would be great. So also just to confirm, this is very specifically bulk bill for telehealth now. We're not talking patient claims, meaning you can't have a gap.
Yeah, that's right. So at least for the chronic disease management codes, those are bulk bill only. This is quite different than other schemes and other previous item codes in Medicare, where as a provider, you could choose to run things as bulk bill, which means the patient is assigning the benefit to you as a provider and Medicare is paying you, versus a patient claim, where in a patient claim, a provider can charge any amount that they want to. The patient will pay for that fully, and then the benefit goes to the patient. Now, at least for the chronic disease management ones, those are bulk bill only. There are other funding schemes that if the patient is eligible, you can still run those as a patient claim. As an example of that, the eating disorders and focused psychological strategies support both bulk billing and patient claim, but specifically for chronic disease management, those are currently bulk bill only.
Okay. Now, you're also talking not just bulk bill, we're talking chronic disease management, formerly known as EPC and still currently known to many as EPC. So does that mean they need a referral from the doctor in order to do telehealth at the moment and get the rebates?
Yeah, that's correct. So you'll need a referral, and it usually comes from a general practitioner, and they will have a treatment plan outlined for that.
Does the referral need to explicitly enable telehealth? Like, if let's say you get it from a GP, do they need to say telehealth's okay for this, or it's not up to them?
No, that's really at the discretion of the provider, and it needs to be clinically relevant for the patient, but that's the discretion of the provider to say that this is part of a necessary service.
Okay, and normally they get 5 sessions per calendar year, if I'm not mistaken. Is this going to count as those sessions?
Yeah, so this will count towards one of those sessions, the same as if a provider went to see that for an in-person session at a clinic. So it's treated the same in terms of counts against treatments.
Yeah, and I see someone's making a note to be clear, and this sounds correct. They're just saying to be clear that previously they could charge above the rate given for chronic disease management or EPC, and with telehealth they cannot at the moment anyway.
For chronic disease management, yeah, that's right. It's bulk bill only. For in-person sessions, you can charge above that and run it as a patient claim, and it could be any amount that you want. This new scheme is a little bit different. And now, just that caveat too, that if you're doing services under eating disorder or focused psychological strategies, those are different, and those continue to have the old rules, which allowed for bulk bill or patient claim.
Okay. Practitioners' provider numbers, if again, like, correct me if I'm not right on this stuff, because it's why I have Pete here that does know these bits, but they are dictated to a location at the moment. So practitioners have a provider number per place they work right now. What's the implications of that for telehealth?
So on telehealth, you'll still need to list a provider number, and the guidance is generally that you use a provider number where you would normally be delivering in-person services for that patient. It's difficult to police that, but as long as it's an active provider number, you can essentially use that today. You don't need to do any other activation for it. It's there, it's enabled live right now.
Okay, so if they, practically just use, if they worked in one clinic only at the moment, if they just use the provider number they have for that clinic, that would be appropriate for now.
Yeah, that's correct.
Okay. Just confirming, at the moment, someone's asking in the chat, so it appears it does not apply for Chinese medicine, acupuncture, and naturopathy. And you were saying that's also, they don't do bulk billing for CDM, is that right?
Yeah, correct. So it's the same rules.
Yeah. What the actual fee is that the same as it was before, like the $53, $63 thing?
Yeah, that's correct. So it continues to be paid at what's called 85% of the MBS rate. And so effectively a provider will get rebated from Medicare $53.80.
Okay. And what is the 63 number? I know there's something funny that goes on where you can get a little bit more.
Yeah, it's always a little bit confusing. So there's what's known as the 100% fee, which is $63.25, I think it is. And there are some professions where a provider can get 100% of that. GP consultations is one of those. And there are some other concessions for providers working in regional and remote areas of Australia that deliver those services that get additional practice incentive programs. But for the majority of people, it will be the 85% rate, which is the $53.80 that'll be provided.
Sure. I see a question coming in about if people have met their Medicare threshold. I assume that the same rules that normally apply for bulk billing CDM is going to apply here. The telehealth won't be the distinguishing factor for that.
Yeah, that's correct. So there's no additional sessions that are allocated for chronic disease management. There are additional schemes that are in place. So it might be good to see if the patient is eligible for one of those other ones. Earlier this year, and it'll exist for the rest of this year, there's the bushfire relief one, and that focuses on a lot of mental health sessions and capabilities. So that is a separate funding scheme from chronic disease management, and the patient may be eligible under that. So it's wise to look through.
There's new item codes for these?
There are. This is another change. It's been really simplified. So in the past, each different modality or professional group had different item codes for chronic disease management. Now there's just two, and the same two for every single provider. One item code is 93,000, and that's what you use for a video-based telehealth consultation, and that applies for every profession. And the other is 93,013, and that's for phone-based or audio-based consultations.
Okay. With those item numbers, I assume that Medipass has some information around on it, but also on our Cliniko help site, we have an area dedicated to telehealth now, which we're adding a lot of information to, and we'll make sure we have the item codes there and details on the claiming under that section as well. So another big one that people have been mentioning was the consent for bulk bill from the patient. How does that work with telehealth?
Yeah, so it's a little bit different than in-person ones where the patient needs to give consent for it. And some people have advised under the old rules, you would previously have to mail out the statement of assignment of benefit and then get the patient to sign it and send it back. Medicare is accepting email-based acknowledgement of it. So there's actually a template listed up, and we'll be sure to include a reference to it in your user guide, Joel, that basically says the patient gives consent to running this as a bulk bill claim and is assigning the benefit to the provider. And that can be recorded in an email trail. Technically, Medicare can audit to see if that was conducted in the past, and a provider will still need to give that what's called the DB4 form, the assignment of benefit to the patient. And you can do that via email.
Is that the same thing? Is the DB4 form that they already should be doing? Because if, again, I know that it's maybe not as common practice as it could be, but there's a form that already people should be printing out, getting the patient to sign, and then giving to the patient to take away, right, for every bulk bill. Is that correct? Yeah,
that's the way the legislation is written right now, and it's technically the same for telehealth, but in the telehealth context, you can deliver that to them electronically, like via email or some other method.
But the actual consent that we're talking about is separate to that. That's not one and the same. So we're talking about consent before, and that's almost like confirmation afterwards.
Yeah, correct. So the way it's written in the guidance given by Medicare is that you should get consent from the patient electronically in an email that says they assign the benefit and that they're okay to do this electronically. There is specific wording that's been put together by Medicare on how to do that.
Okay. Currently in person, how are people doing that? Is that just a verbal acknowledgement at the reception desk where they're just like, do you want me to bulk bill it? And they say yes. Is that how it currently
is? Yeah, that's it.
So obviously that's not recorded, but we know for a fact they do want it recorded. Like if you're doing telehealth, you could obviously ask the same in the video call. I just wonder if they've been explicit on that that's not okay for telehealth to get
look, I mean, we're certainly not the police on this.
Sure.
There is a right to audit back on these things. It's the same as even giving the assignment of benefit form, which as a provider, you might print out, you have the patient sign it, but the difference is that the patient then takes that signed form with them. So it's quite difficult to say as Medicare, how do I audit that actually happens, because the patient has the form, not the provider.
Yeah. Okay. Let me see what other questions we had coming through. So I think I know the answer to this one now, based on a previous one where you said the doctor did not have to explicitly say this plan can be done via telehealth. But so people that are already in the middle of a chronic disease management plan with a patient, they've already started that, they've done 2 in-persons, they could then start doing telehealth for the remainder of it. It's okay for one that's already been started.
Yeah, absolutely.
Okay. So for practitioners to, I'm just going to check before I move on to it, because people are starting to ask about the template for the DB4 and the consent part of it. Maybe that's something that we can have a chat about afterwards, Pete, and put together some sort of help guide or something around what to do with the DB4 form and getting patient consent, and see if we can get some sort of proposed workflow for that.
Yeah, absolutely.
So we'll so someone has said you missed consent. With the consent, we're just saying you do need to get patient consent, and it can be done electronically via email. But Pete and I will chat later and see if we can put together some sort of proposed workflow that could be acceptable with Medicare to do both your DB4 form and consent. So I'll leave those to later, and I'll share that out with people afterwards. So the next one I had was, so practitioners that want to start claiming bulk billing via telehealth, do they need to do anything? Do they need to register with Medicare, or is there anything that needs to be done other than use the new item code right away?
No, just use the new item code. If you're registered with Medicare and you're doing claims today, including bulk bill, you can access and use the telehealth codes now.
Okay. What about the duration of the sessions? So is there a mandate for how long these sessions should be, or anything we know about that?
Yeah, so the minimum session time is 20 minutes. How long you go beyond that is really up to you as a provider. Now, that's the case of the chronic disease management one. Those other funding programs like eating disorders and focused psychological strategies have additional codes that if a session runs more than 50 minutes, there's a different code and a different amount that's rebated.
Okay. With payments, I assume this is going to be similar to how it already works, but the question is, can patients pay upfront? So like at the time of booking for a bulk billing session?
So the way that bulk billing is written is that you're not, as a provider, you don't charge for that service. And that also includes anything around a booking fee or administrative fee can't be charged to the patient. And you're also not allowed to charge a gap fee on top of the bulk bill rate. And that's how the legislation is written. Now, if it's a case that you're collecting payment from a patient before a session, I suppose you could do that as long as you ensure that that payment is fully rebated back to the patient before running it as a bulk bill.
Okay, so people could still do a nominal amount on booking if they feel the need to make sure the person turns up for the session, as long as they refund that completely to then process the bulk bill.
Yeah, that's the way it's written. I think the spirit of the legislation is that it's bulk bill so that those without the financial capacity won't have to pay anything and can simply run it as a bulk bill claim, which means there's no out of pocket at the beginning, during, or end.
Okay. I'm going to go through, before we move on, I've got a couple of different topics to talk through related, but I'll just check the questions we've got here and see if there's anything we haven't covered yet. So can only current EPC or CDM patients use their Medicare, or do patients need to get a new referral? So that's, I think, sounds like what we covered, where they can continue an existing plan with this without getting a new referral.
That's right. Yep.
Okay. What else we got? can they alternate sessions? So could they do one bulk bill and then the next one the client might pay privately with no rebate? Just because the bulk billing fee can be quite low. So they're wondering if they can maybe alternate and do their own in between.
Yeah, absolutely.
So I've got, can Chinese medicine practitioners use Medipass and Telehealth? I expect the answer is yes, but not for this Telehealth bulk billing CDM. Certainly they can use it for Telehealth, but like we said, not for the rebates that we're talking about now.
Yeah, so they can certainly deliver it. They'll be charging the patient as a patient-funded or direct contribution from the patient.
Yep. I've got a question, I don't know if we covered it before, about remedial massage and myotherapist, if either of those are included.
Not currently.
There was a question coming back, can psychologists charge a gap via telehealth?
Yeah, psychologists and clinical psychologists, occupational therapists, and mental health or social workers with a specialty in mental health can charge a gap, but not under the chronic disease management scheme. That would be under one of the other schemes like eating disorders or focused psychological strategies. Now the patients will need to be eligible for those, and there's different eligibility and qualification requirements for those schemes that's separate from chronic disease management.
Yep. Does it apply to nutritionists?
Dietetics is certainly included.
Okay, good. I've got a question about price of Medipass and per claim. I think we'll get to that in a little bit when we do the tech stuff we've got coming up.
That one's pretty easy. We've waived all charges for telehealth through at least 30 September. And that's not just the new COVID ones, that's all telehealth.
Fantastic. We can dive into more detail on that as well in a little bit. So the codes for physio and the rebates amount, we talked about rebates amount, and 93,000 and 93,013 is the correct two codes?
For chronic disease management, yep, that's right.
Okay. Mental health plans included in the chronic disease management is a question.
Mental health, so psychologists, clinical psychologists, OTs are included in chronic disease management, but if it's focused particularly on mental health, the patient might be eligible for different schemes, which is focused psychological strategies, which normally allocates 10 sessions for a patient, or perhaps eating disorder one, if it's related to that. That one is a more generous program with, I believe, 20 or 24 sessions per calendar year.
Okay, great. They currently use high caps in the clinic. If they join Medipass, that means they don't need high caps in the future.
So high caps is a partner of ours. High caps is great for in-person based payments and claims. We power the High Caps Go side of experience. So you can use a High Caps terminal to type in the codes for telehealth, as long as you type in the full Medicare card number. So that would be an option.
Okay. Is it team care arrangement for CDM? I don't understand that question. Maybe you do.
Yeah, there is team care arrangements. Those are usually where it's set up between providers and a general practitioner or another specialist. There are codes established for that. Now the team care ones for telehealth, I believe, are only set up right now for GP or medical specialists, not for allied providers. I could be wrong on that one. We might have to get back to that.
Okay. Someone else asking, has CDM changed for face-to-face treatment as well, not telehealth, where they can only do bulk billing without the gap?
No, that remains the same. So if you do an in-person consultation for chronic disease management, that could be patient claim where you charge above the MBS rate, or it could be bulk billed.
Sure. Do you know if there's any plans to increase the quota of the CDM sessions? I guess that's the 5 per year.
No, I haven't seen that, but I'm making a guess here that the government may introduce additional support for mental health coming out of this, pretty similar to what was done during the bushfire relief. And in that case, that was a new scheme that was set up for people impacted by bushfires through Australia. And that was a new funding program that was giving additional benefit for those that were impacted by the bushfires and with a mental health issue.
Okay. There was some talk of someone gets double bulk billing. Is that right? Like, what's the double bulk billing stuff that was mentioned? I thought I'd seen somewhere where they talked about a double bulk billing rate, and someone's asking the question as well. They announced some double bulk billing.
I'm not quite sure what that means around the double.
Like I think it's like it might have been for GPs that we're getting double the amount or something. I can't remember. There was something.
Well, there is something called a practice incentive program, and what Medicare have done is double the practice incentive program. So if you're a general practitioner and providing that you're operating at least 4 hours a day, and there's some caveats on that where you actually have to operate 4 hours a day in person, they're temporarily doubling the practice incentive program, which depending on the session will give an additional $6 to $12 per session on there, in addition to the standard bulk bill rate.
Okay. Someone was just confirming, although I don't know if we've answered this since then, that if they can still charge their fee, then pay the client pays the fee and they claim back from the government, but that's not correct for telehealth. That would be the patient claim side of things, and it's only the bulk billing that's via telehealth at the moment. Yeah,
that's right.
So someone's just confirming if they've got a patient that wants to use telehealth, they would first have to get a program from the GP before they can see them. Most are avoiding the GP right now. So first up, specifically, this is if you want to be able to put them under chronic disease management and do bulk billing. If you just want to see someone via telehealth and they pay for their own session, this is obviously unrelated to that. Can GPs do this remotely now? Because they're saying also people are avoiding GPs. Can GPs do telehealth and issue out these referrals without anything in person?
Yeah, that's right. So there's a whole new set of codes for general practitioners that would allow them to deliver most of their services remotely via telehealth.
So someone's asking how to set up the claiming directly to Medicare. I think we'll show that in the technology bit. You can do it via Cliniko with Medipass. You can still use Proda to do this kind of thing online as well remotely. We'll talk about that in a little bit. Is the item code the same as previously? As we've mentioned, it's not. There's new item codes, and those item codes are the same for all modalities. There's just two codes, one for video telehealth, one for phone telehealth.
Correct. Yeah, that's for chronic disease management. There's only two codes to use, and that's for all providers.
Yep. Again, confirming patients don't need a new referral. Existing ones are okay.
Existing are okay.
That's no additional registration with Medicare is required.
No.
Does the consent need to be attained for every session for bulk bill?
Oh, that's a good question. I've not seen any clarity on that. I suppose if it were worded in the way that it would be for future sessions, do you give consent, that would likely cover the audit requirements.
Sure.
I think there's a few questions on here on how GPs send over the referral. It could be via email. It could be via one of the secure messaging portals, fax, I suppose. It just needs to be transmitted, and it should be transmitted using a secure mechanism from the GP because it usually contains sensitive information.
Okay. Is there any way to tell if someone's used all their 5 sessions or not?
This hasn't been made the easiest. We would love to introduce that into it. There's only 2 ways to do it, and that is on the day of the service, a provider can either call up Medicare to see if there is a session remaining, or they can log into Prada and using the web services in Prada to see if the patient is eligible for a session, but you can only do that on the day that you are claiming the service.
Okay, so I think probably a good time. There's still a lot of questions here. Maybe we'll skip forward and go through more of the planned content because we're getting through the time here. And then at the end of it, anyone that wants to stay around to go through more of the questions are more than welcome to do so. So I definitely want to ask about DVA and other sort of rebate plans that are around. What's happening with this? I guess we'll start with government-based ones first.
Yeah, so DVA is great. They're following Medicare's lead on here, and that's pretty traditional. The last update that they did was 5 or 6 days ago. Now that was when Medicare introduced this, and it was only eligible for patients and providers that were vulnerable or isolated. And that's how it's currently written. However, DVA had said that they will follow in step with Medicare. So our expectation is that DVA will follow and allow telehealth sessions for all providers that were previously eligible to deliver in-person sessions. Now that's not happened yet. It's only for those patients that are vulnerable or isolated, or providers that are vulnerable or isolated.
Okay. What about private health insurance is another big one everyone wants to know about. And I believe the answer is not the same for every fund, or is it?
No, it's not the same for every fund. There's been talk about enabling it for all professions. Right now it is per fund. So if we just talk about the two largest ones, which is Bupa, Bupa has opened it up and they're now supporting it for a number of sessions where there's an existing patient-provider relationship. And that includes providers that are psychologists, counselors, occupational therapists, speech therapists, and dietetics only. We're hoping that that gets expanded out to cover other professions. If we look at Medibank, it's to support psychological strategies. So that would include psychologists and clinical psychologists. Unfortunately, neither of those have been set up for electronic straight-through claiming, which means that you can't yet run those claims through on HiCaps or HealthPoint or Medipass yet, unfortunately. They just haven't been mapped in. So what providers can do is manually charge the patient, give them a full invoice and receipt, and we'll post up some details around what should be included on that receipt. And then the patient can seek reimbursement from their private health fund directly.
Okay, sounds good. NDIS?
Yep, NDIS is 3 different funding management programs, being agency, plan managed, or self-managed. So for self-managed, which is where the patient is paying for things, you can deliver telehealth sessions on that. And there's actually, I know because my daughter's in the program, you can't even indicate how that session was delivered, but it is certainly permitted on there. So the patient will then upload the invoice and get rebated from NDIS. In the case of plan managed, you can certainly deliver those services via telehealth. The invoice is sent to the plan manager and the plan manager will rebate or reimburse the provider on that. In the case of agency managed ones, those are where a provider is directly submitting an invoice into the agency. They've talked about supporting it, but there's not, there isn't a different set of item codes to differentiate telehealth from in-person sessions there.
Okay. Let's move forward a little bit. I see there's still some people with bits of confusion. So again, we will come back to some of those questions at the end of it. I'll talk a little bit about the technology side of things. So if people are doing this remotely and they're doing it from home, how they practically achieve this, what they actually do. So firstly, if you're using Cliniko, what you can do in Cliniko is you can do your telehealth. We launched the video chats within Cliniko, what is it now, about 5 days ago we launched them, and they have been used a lot since then. We've seen already more than 10,000 video calls done through Cliniko in the last few days. So you can very easily do that. I'll demo that at the end for those that want to see it. And we have Medipass integrated into Cliniko that allows you to do this bulk billing. You can do this bulk billing for telehealth through Cliniko. I assume that's in there right now, Pete. There's nothing that stops them doing these codes.
No, nothing. Just add in those codes, send it through, and it will work.
Okay, so in Cliniko, that's where you'll probably set up your billable items with these codes in it, so you can choose them easily and put them into your Medipass bulk bill when you do it. And again, I'll do a demo of that shortly. So people were asking about pricing. So what's overall, Pete, I guess, what's Medipass's normal pricing? What's it like at the moment for telehealth? Like you mentioned, free, which is good. Do you want to just give a summary of that?
Yeah, so the way pricing works is that it's for Cliniko customers, it's 20 cents a claim, and that's either a bulk bill or a patient claim. There's no sign-up fees. There's no monthly minimum charges to that effect. If you're running more than, I believe it's 200 transactions per month, it goes down to 12 cents a transaction. That said, we made a decision earlier on to waive all charges for telehealth-based services. So that's not just the new the new COVID ones, that's all telehealth-based services. There's no charge whatsoever for that until at least 30 September.
Okay, fantastic. So people could integrate with Medipass now if they're using Cliniko, and if they were just using it for telehealth, they pay nothing for at least until the end of September.
Yep, that's right.
Okay, great. So if they're not using Cliniko, other than being crazy, they might want to look for other options to do, or if they're not using Medipass. So Proda, they can do this stuff in right now?
Yeah, I'd love for providers to use us, but you can also use Proda. So if you have a Proda login, you can submit bulk bill claims, including the new COVID items through that. One notice on there is that it's currently, they haven't updated all their item schedules properly. So these two new codes, 93,000, currently show is only eligible for Aboriginal and Torres Strait Islander health workers. That's not right. It just hasn't been updated yet. It's actually for all chronic disease management providers.
Okay, excellent. That's a good tip. And if people want to do private health insurance via telehealth, where you mentioned there's some circumstances they could already, and let's say they're normally using high caps, I assume they can't just take their terminal home with them or something like that. They're not going to have a card to swipe. What do they do at the moment?
Yeah, so in the case if you're using like a high caps or one of the health point terminals and you're doing what's called Medicare Easy Claim for that, the high caps terminals will allow you to manually type in the Medicare card number, and you can run that with the applicable item code, and it should work. I've not tested it.
Okay. So that's for the Medicare bit still though, but what about, you said some of the private health insurers are offering some things for telehealth now? So
yeah, they are, but they've not yet mapped in those codes for electronic straight-through integration.
Okay, so they couldn't do it via a machine nor via Medipass for now, any of the telehealth private health insurance claims, is that correct?
Yeah, that's right. I mean, you can continue to run standard in-person private health claims, but the telehealth ones, they haven't introduced new item codes to differentiate it. And so providers are advised just to charge the patient like a private patient, to provide an invoice that meets basic requirements, and then the patient will seek a rebate from the private health insurance.
Okay, so you just don't need to process it for them.
Yeah, that's
the
right.
Question that's probably better for me to field this one, Pete, is Medipass easier to use than Proda? We're needing to go without a receptionist for some time. Now, I can answer this question even though I've never used Proda, but I have been involved in integration with Medipass into Cliniko, and I cannot imagine that Proda, from all I've heard, is going to be anywhere near as easy to use as Medipass is. Harder for Pete to give, I think, the answer, obviously, his business, but I have no affiliation with Medipass other than we talk to them and we've integrated it into Cliniko. I'll do a demo very soon. You'll see it's going to take seconds to do these claims in Cliniko through Medipass. It's really easy.
Yeah, I think it's a lot easier. The one thing, admittedly, the one thing that we and every other integrator into Medicare can't do is show the number of eligible sessions on EPC, or I'm sorry, chronic disease management. That's something that you have to do through PRADA HPAS or to call up. We're hoping and lobbying Medicare to change that, but it's just not yet available. We do a few other things though that PRADA and HPAS don't do, which is we send alerts to the provider if a claim is rejected. We send over payment reports to show you exactly what Medicare is paying. And we send over something called processing report. So a processing report is where there was some problem processing the claim and instructs the provider on how to fix that up. So those are things that you get coming out of us that you wouldn't automatically get through a PRADA lodged one.
Cool. I want to switch across and do a quick demo now. I'm conscious of time, and then we'll come back to other questions we have remaining. I'll start with the telehealth component. It'll be fast anyway, and then I'll move on to the Medipass bit straight after. If someone can confirm. Pete, can you see my screen there? Great.
Yep.
Okay, so this is my appointment calendar in Cliniko. I'm just going to show quickly, if you're an existing customer or even a new one, how you'd set up telehealth in Cliniko. So you'd go to your settings area and into appointment types. You can see I've already done it, but I'll go in and show you anyway. Go into one of your appointment types, whichever one you're doing telehealth. It could be existing or it could be a new appointment type, and just turn on telehealth for this service. If it's a new one, that just turns it on and all your new appointments of that appointment type will have it. If it's an existing appointment type you already had, it'll go and apply telehealth to all your upcoming appointments. So they'll all get the telehealth sort of meeting link put onto them automatically. So you update that. The other thing you'll probably want to do if you're turning on telehealth is just go to settings, appointment confirmations, and go to the email letter that you send out, if you're sending them out when an appointment's created. And you can just go into the location for a telehealth one, and instead of putting an address, you can just put a thing that says something like, you can click this link to join the session, and you put this placeholder in here that is the link to the meeting, and you get that out of the appointment drop down here. That'll insert that telehealth link. So that's going to be a link that your patient receives. They click it, it takes them straight into the meeting, no login, no download, anything. Can work on almost any device, the phone, tablet, computer, whatever it might be. They just click the link and they're straight in. That'll be in the email they receive. And also, if you attach a calendar event to the confirmation email, then it'll also be in that calendar event in their calendar to go straight into the meeting as well. Once you've done that, I probably should have pre-organized this. I'm going to see if I can find someone quickly to join me in the meeting. I know a few people in our team are watching along. Hopefully one of them can message me and say, yes, I'll join your meeting, and I'll have them join the call. So I'll create an appointment on the calendar here. So I'll create it for Barry because he's set up for payments as well. And I'll put in a patient here. I'm going to choose a case. We've got cases in Cliniko now. We launched late last year, and I'll create that appointment. Once that's created, ordinarily the email goes out to the patient with the link in it. In this case, we're not going to wait for that. So I'm just going to go into the appointment myself. It's time for my appointment. I could copy the patient link here, and in fact, I'll do that now because I need to give it to someone to come join me. Let's see who's prepared to jump on. If someone, I've dropped that there. Hopefully someone will join our call in a moment, and I'll go into the call. So I just clicked join call, and I'll click here, connect to the call. And now I'm in and waiting for the patient to turn up. Now, while I'm in here, I'll show you very quickly what this screen looks like. So you've got some settings here. If you need to change which camera or which microphone you're using, you can turn on and off your microphone and camera. You can do screen share in here. And as well, I've got someone joining, which is nice of them. Except with our video. Yeah, I'm not sure why, but someone has joined. They'll be able to see me and just not hear me. Also, we have a chat here, so I can type into the chat here, hello, and they can respond to me via a text chat in that call as well. It looks like our patient didn't enjoy the call too much, so they left. But that's pretty much it. It's really simple. Down the bottom here, we will have treatment notes and the ability to write a new treatment note there. View your existing treatment notes. We'll also be showing medical alerts there. Excuse me. So there'll be a lot of information on this screen to help you through your treatment while you're doing the telehealth as well. And that's pretty much it. I'll hang up from it and go back to the Cliniko calendar. You can see super easy to get in, and it'll be very easy for your patients to join as well. Nothing they need to do. What I'll do also, we did launch something additional. We did launch the ability to take payments through online bookings last week also. I'm not going to go through that at the moment because kind of unrelated, especially to what we're talking about today, where you can't take payments in advance. If you're interested in that, if you check out our Facebook page or our blog, there's some information there on the online bookings payments. What I want to do now is just walk you through quickly the Medipass side of it in Cliniko. So you're going to do this telehealth bulk billing for CDM. You can click on your appointment when it's finished, or maybe you're going to do this while you're still on the call with them, pending what we decide about patient consent, and if you can gather that from the person at the time. And we're going to do add a payment here. So that'll bring up an invoice screen. It's pre-populated with all the details we need. It's already chosen a bulk billing option that we've set up in billable items that also has the appropriate price for bulk billing in there. And I'm going to create that invoice. When we get to the payment screen, instead of collecting a payment, we're going to do bulk billing. Again, reminding that if you do bulk bill, you cannot collect a gap or charge any different to the amount that the bulk bill will do. So I'll click on bulk billing here. This account is obviously integrated with Medipass already. And this will come through and it pulls in automatically all the details we have for this particular session. So we know who the practitioner is, we know the patient, we know who's getting the benefit here. We've got the referring doctor information because that was in the case that I linked at the start when I was making the appointment. You create a case when you get a new referral and put the referral details into it. Of course, you could edit any of these things as you go through, what the item is, and then finally submit claim. So that question before of, you know, which is easier, you've got to the payment screen here, you click bulk bill, confirm it's accurate and do submit claim. And that's all you need to do to process that bulk billing telehealth item. The only note would be the service item itself would be that different code for telehealth. So I had a 10966 here, but this would be that 93,000 telehealth code that you'd be using. What Cliniko will also do is it sent it off. When that's approved, it'll come back and update Cliniko to let you know that that's been paid. Medicare's approved it and will mark this invoice as closed once that's been done. So a question, when you open telehealth, you need to open two windows, one for telehealth, one for the patient notes. Yep, right now that's true. And soon we'll have it integrated all together for you. The easiest way to do it when you join the room is if you're on Mac, hold Command, or on Windows, hold Control, and then click Join Room, and it will open it in a new tab for you. We've got a question. How long do payments from Medipass take to come into the bank account?
Yeah, so if it's a bulk bill, we don't actually pay those. It's Services Australia pays that, and it is generally next business day in the morning.
Okay, and I'll just go through and see what other questions. Is integrating with Medipass simple? Do you want to talk to that one, Pete?
Yeah, so there is a sign-up process. So it is an application form that you will complete online. We will send the provider over a PDF version of it, and the provider will need to send that PDF form over to Medicare. I realize this is a little bit of a backward process, but it's the current one supported by Medicare. It takes 5 business days generally to get set up online with Medicare for online claiming. After that's done, you can submit claims through. In Medipass, there's an account section on there that includes an API key. You essentially go into Cliniko, you enable Medipass payments, and you put in the API key, and it will enable the integration. So it's pretty straightforward on that side.
So I've got a question, Medipass for face-to-face consults where they can charge more. So instead of doing a bulk bill on the screen I just showed you, you would just collect whatever payment you normally collect from the patient, enter it in as perhaps credit card. And when you get to the next screen in Cliniko, you'll be able to raise a patient claim on their behalf. Because in that situation, you collect all the money from the patient and then you raise a claim on their behalf and they're going to get the money back from Medicare afterwards. So you can still do that in Medipass in Cliniko. It's just the next screen if you didn't do bulk bill.
Yeah, correct. And we also have a card payment option on there. So if you want to accept the patient or card holder payment card, you can type in that information into Medipass and run it. You can also send it as an SMS request to the patient. They'll get a link. It'll ask for their card number or Apple Pay or Google Pay. They'll pay for it, and that's it.
So just to confirm what you're talking about now, Pete, this is what you just launched, right? Which is like the little virtual credit card terminal?
Yeah, we just launched it, and I think I got a quick video, if you don't mind holding on for about 30 seconds here. And what I'll do is bring up this video so that you can see what it looks like.
Just while you do that, Pete, while you grab it. So what this is Medipass have created a little virtual terminal there. You can process credit card payments if you're working from home and you don't have a terminal or something like that.
Yeah.
And at the moment, you do this within Medipass's interface itself, not within Cliniko, and we're looking to add this widget into Cliniko at some point too.
So here's how it looks. It's really simple. It's basically just a replacement for a credit card terminal. And if the amount is under $250, you can enter it directly in. If it's more than $250, or if you just choose to send it to a patient, it works like this. So you put in an amount that you want to charge, put in their mobile number. It will send that over to the patient. They get an SMS. They click on that SMS. It has a link. They can type in their card number, or they could just pay with Apple Pay. Hit pay. It's done. Goes back. The provider gets notified instantly that it's been approved, and then you can choose to send an email receipt to the patient. And that's it. It's pretty simple.
Confirm as well, in case we have people watching from elsewhere, this is for Australia specifically, these payments for now?
Correct. We'd love to expand out to other countries. We hope to do so in the coming months, but this right now is Australia only.
Yep. Okay. Are you looking at including a share PDF or JPEG option? If you're referring to Telehealth share PDF or JPEG, you can share your screen at the moment, so you can show anything on your screen right now, and likely we will add file sharing into the chat in the future. This question, how do we set patients with Medipass? I don't quite understand what you mean, so maybe if you just want to add some more info, but generally speaking, they're already set up in Cliniko, so you wouldn't need to, it just pulls the data across.
Yeah, you don't need to set up an account in Medipass for the patient. There's no need.
I just joined, we run this again. We will share this video online, so you'll be able to watch all of it. How long do we have group calls in Cliniko? My guess is maybe it's a week, maybe it's a little more, I'm not sure. We haven't hit any roadblocks yet with it, but you never know. Still a bit confused with setting up Medipass. Repeat the key that you need to include. If you go into Cliniko and you go to add Medipass, it will, in the settings integrations area, it'll link you through to some help articles and things that make it really easy. And then also Medipass have like live chat on their website. So if you have any trouble, you can reach out to their team through that. But I think that if you go into Cliniko settings integrations, it'll lead you through nicely and you'll find it quite simple. Does the patient get money straight away like Easy Pay?
So Easy Claim is a nice service, but the one that we use is called Medicare Online. So that has a service to rebate the patient if it's a patient claim by next business day. That said, if it's run prior to 9 p.m. Australian Eastern Time, we're finding that most payments or most patients will have that rebated into their bank account later that same day.
Okay. Karen asking about, is it an alternative to Stripe? So at the moment, the Stripe integration we have in Cliniko is very specifically for capturing payments for online bookings. It's nothing to do with Medicare, nothing to do with private health insurance payments, which is a big part of what Medipass is about. So I think it sits differently like that. Probably at some point you'll be able to use Medipass for all payments within Cliniko, including just credit card payments in different places. But right now, if you want to do online bookings payments, prepayment, that's with Stripe. And if you want to do Medicare and private health insurance, that's via Medipass. And alternatively, you can also collect credit cards manually with the new feature that Medipass just launched. The SMS link that you send to the client, does that time out, Pete?
Yeah, but I think it's 30 days. So you've got a bit of time.
Are there fees for the credit card payments that you just showed that last bit?
There are. Unfortunately, we don't set bank fees. Credit card issuers still charge quite a bit for it. So the fee is 1.8% and 30 cents a transaction. There's no other SMS fees or anything like that.
Okay, great. Someone asking how they'll access this again. So we will put this video everywhere we can find it. We'll put it on our Facebook, we'll probably put it on our blog, on our help site where we have a hub around telehealth and COVID-19 information. We'll put it in there too. We'll make sure it's available in a lot of places for people.
There was one question on there that says the support site says the link expires in 15 minutes. That's the case of private health insurance claims. So if you run a private health insurance claim, that link is only eligible and valid for 15 minutes. That's not for the other payment request links. Okay.
Does our Cliniko telehealth comply with the Australian government privacy rules? It absolutely does. There is a lot of misinformation going around at the moment, probably not surprisingly because of how this is all rushed through. But in Australia, the telehealth calls are going to be governed by the same Australian privacy principles and the Health Records Act that other patient information is. Ours specifically, it's peer-to-peer encrypted. It never hits our servers. It's encrypted the whole way. It meets all of the rules easily. We also meet rules in Europe for GDPR and in America for HIPAA compliance. I know there's a lot of fun information going around that we need HIPAA compliance in Australia for telehealth, which is not true, but we do meet it anyway, even if it was. But the short answer is yes, it meets all the requirements you have. Can I set up Medipass via Cliniko, or do I need to apply separately? If you go settings integrations in Cliniko, it will walk you through setting up with Medipass. You do need to have an account with Medipass, and there's some setup for Medicare that you do via Medipass, but the Cliniko side of it will walk you into that part. And like I mentioned before, you can chat with the Medipass team from their website as well if you need support with it. Someone's asking how many will our group chat have for telehealth. So I think the next release will be a maximum of 4 people, and then we'll reevaluate again. Medipass for kids. I'm not sure they should be doing processing payments.
That's actually, that is a good question. That's come up in the past. Now, this doesn't apply for bulk bill, but patient claims, if you're doing Medicare, if the patient is under 15 years old and you're doing a patient claim, you'll need to have a parent or guardian on there. The claimant will need to be 15 or older to have the rebate applied into their account. If they're under that period, the money just sits there.
Does that work the same for bulk bill? Because when you're talking patient claim, we're indicating who's going to get the money. What about bulk bill where the money's coming to the clinic? Do you still...
Money comes to the clinic, and I'm assuming that the clinician is over 15 years old, so no problem.
But I mean, the kid will have its own Medicare number still, so they don't need to link it to the parent for that purpose.
No need to link it to the parent.
Okay. Is Medipass only for chronic disease management, or can it be used for DVA? So in Cliniko, it can't be used for DVA yet, but via your interface it can, right? Is that correct?
Yeah, correct. So we are set up for DVA, and if you have a Medipass account that's set up for Medicare, DVA is automatically added in, so you can use it today.
I guess just on that topic, do you want to let people know, what other funds does Medipass handle already if they're doing it via your interface?
Sure. So we do private health insurers, and that's currently running as High Caps Go. So that works for 2022 private health insurers, including Bupa, Medibank, NIB, and others. So that's on the private health insurance side. We do state-based compensatory funds. So iCare New South Wales is the largest one that just went live a week ago. And so that is for the workers' insurance scheme there. So providers can send through a claim. You'll know instantly if it's approved or not, and the money's in your bank account next business day. And there's zero cost for doing that.
Cool. We've still got more questions. I feel mindful. I just realized the time, Pete. I know you had another commitment. Should we finish up now, and perhaps we'll get any other questions people have and find another medium to answer them through?
I'm happy to hang on for a few more minutes.
Okay. Right. Just thought I'd check. Don't want to make you late for something else. There's only a few more here so far. Let me quickly skim through. Cliniko Telehealth. Can you share your iPad or iPhone by screen sharing? I don't know. Probably. I'll have a test of it, or you can. If you've got Cliniko, you can easily just log in and give it a go. It's free anyway in Cliniko for foreseeable future. Otherwise, I'll find out and let people know. We don't have Cliniko set up for telehealth between staff members at the moment. Soon after direct card payment, does it reach a provider bank account? We talked about that. Oh no, that was a patient bank account. What about how soon does a provider get it if they're doing direct card payment through your new virtual terminal thing?
Next business day.
Okay. Someone's saying they had trouble setting up High Caps Go. Probably best step, Nicole, would be contact Cliniko support to start with. If it's something we can help with, we will. Otherwise, we'll connect you with Medipass for that.
I do know, and we've been advised by the High Caps team, they're all working remote, that they've had a number of issues onboarding new providers. Now, that only applies for private health insurance claiming. So I think they're just getting adjusted to doing remote work. So there might be some delays if you want to set up the private health insurance side.
Okay. Someone else is also talking about some verification email issues they had signing up with Medipass. Just reach out to the Medipass support team for that, Jules. I'm sure they'll be able to help you out.
Yeah, you can jump onto the live chat on Medipass, and Sophie and team will be able to help out on that.
Yeah. And Adrian saying they couldn't join right away because it was full. Sorry about that. We fixed it pretty quick, but not quick enough. This video will be available for people sometime later today. I'm not sure if we need to do any editing of it, but we'll put it up sometime later today for everyone. Also, for any more questions that come through, we will wrap it up now. But if you have more questions, we'll post this on our Facebook page. If you comment on the Facebook post with any more questions, we will answer what we can, and I'll make sure that Pete and Medipass people are aware of it as well so they can help out. Also, we'll put it on our community site, so community.cliniko.com. We'll have a post there where you can have discussion about it. So if you have further questions or things we didn't get to today, feel free to go there and post your questions as well. Thanks everyone for joining, really appreciate it. And thanks, Pete, so much for sharing all this information. It's fantastic.
Oh, thanks, Joel. It's great.
Bye, everyone.
Bye.